Yeah. Okay. So we'll be assessing the patient's neck. Before we touch or do anything like that, we're going to just visually inspect the patient's neck for any unusual changes in color, abnormal skin lesions, masses, scars, any edema or unusual pigmentation, as I said. And then we'll be noting the thyroid cartilage down here. So we're going to take our pen light and cast a shadow obliquely across the thyroid, making sure it's not casting any unusual shadows on the other side. And then we're going to be noting the trachea, making sure that it's sitting midline on the patient, and we'll just visually assess that. And then we'll go into some palpation of that. So I'll be taking my middle finger, placing it in the suprathyroid or supratracheal notch, and just palpating, making sure that's sitting midline on the patient. And then we will be checking out the lymph nodes, or not quite the lymph nodes. Actually, we're going to palpate the thymus first, psych. So I'll have you turn this way, and we'll just be noting that the thymus and the trachea are all moving up and down together when the patient swallows. So you can swallow and we'll assess that. There you go. And then we'll be palpating the thyroid gland one side at a time, just making sure that appears normal. Being sure to do so gently so we're not messing up the function of the thyroid. And then we're going to be palpating the lymph nodes. So first we'll start with the preauricular lymph nodes and then postauricular. And then we'll go down to the tonsillar lymph nodes and then to the submandibular, down out to the chin, to the submental. And then we'll be assessing the occipital lymph nodes, posterior neck. And then we'll be assessing superficial cervical chain along the SEM and the posterior cervical chain posterior to the SEM. And then also we can check for the deep cervical chain, although that's oftentimes difficult to feel. And then we'll do the supraclavicular lymph nodes, checking to make sure all of those are feeling as they should. And then we're going to assess the patient's carotid artery. I'll be using the bell side and just being sure there's no bruit over each of those. There we go. And then last but not least, we will be checking out cranial nerve number 11. So first I'll have the patient, I'm going to place my hand over here and I'm going to have you push into my hand. Good. And this way as well. There you go. And then we're going to be checking out the traps. So I'm going to push down and I want you to raise your shoulders for me. There you go. So we're checking out the SEM and the traps for that. And you are healthy, my friend. Ta-da! Did I finish it? I think it went.
You said thymus when you were talking about the thyroid.
Did I really? Did
You
this
said
thing
it
shut
a
off
couple
yet?
times.